Hello, my name is David Trimberger. I'm going to be doing attempt number 2 for my peer-to-peer checkoff for IO medication administration. First thing that I am going to do is make sure that I gather up all of my materials. Starting off, say, with my easy drill, I will go over and make sure that it works. Okay. Then I will inspect all my equipment, make sure that I have the proper size IO needle, make sure that it has the stylet on it. I'm going to have my antiseptic solutions. I got an IV flush. Make sure that I have a bulky dressing properly taped and ready to go. After I have all that around, I'm going to grab my IV solution, going to inspect it for clarity, as well as the expiration date, that it has both of its tail ports, and that it's the correct medication. Next, I'm going to inspect my IV tubing, make sure that there is no kinks, no twists. I'm also going to move my clamp almost to the drip port, make sure that it is fully clamped, and also make sure that the tubing itself has both of its covers as well. Okay, next I'll be putting on proper PPE. Then I'm going to grab my IV bag, move the tail port. Then I'm going to spike my bag, turn it upside down, fill up my drip chamber about halfway. Okay. Then I'm going to open up my drip chamber, make sure that all my air bubbles are out. There we go, I don't see any more. Place the clamp back down, put my IV tubing off to the side. The next one I'm going to do is inspect my needle one more time. I'm going to be inspecting it for burrs, that it has a stylet. I'm going to be giving the needle in the right placement. The next I am going to take my patient, so got my leg. Then if my patient is conscious, then I'm going to give a 2% lidocaine solution to try and numb the area due to this being somewhat of a painful procedure. I'm going to come down and landmark my area, so I'm going to go find my patella, go then next find the tibial tuberosity, then I'm going to go 2 fingers down, then I'm going to go 1 finger medial, so that's going to be about right here. Then I'm going to open up my antiseptic cleanser, then I'm going to start in the center, work my way out. Then I'm going to go at a perpendicular 90-degree angle, going to insert my needle. Then I'm going to stop inserting when I begin to feel resistance or I notice that I am in the that I'm in the bone. Then after that, what I will do is I will take a flush, I will attach it to my IO. I can then draw back, and if I get blood return whenever I aspirate, then I can confirm that I am in the bone. Also, I can go ahead and pull back, get a full syringe of blood, put a cap on it, then I can give this to the ER whenever we arrive in case they want to use blood return from it for any type of lab testing. Sorry, it's also hard to make do, but there would also be a stylet on my IO needle. I would remove my stylet, put it in the proper receptacle. Then that's whenever I would attach my flush. Then next I'll do is I will stabilize my needle with my bulky dressing. Then I will attach my IV solution, open up my drip chamber, inspect for adequate drip rate. Then I will monitor my patient for any undesired side effects as well as any change in patient condition. And then I will clean up my area and be done.